Already moved there a little bit, yeah. Okay. Come on. There you go.
Yay.
Wow, did you hear that sound?
Yeah.
It was like muffled. It was in fluid. You know what I'm saying? That's what I try to tell people. It's like stuck in mud or fluid. It almost sounds like you hear a sound underwater. It's like, last 14 years, all I've done is look at people's backs. I wake up in the morning, I look at people's backs, I come home. I go back to work, I look at people's backs.
He jokes, he's like, I go to sleep and then I dream about working.
I go to sleep and I dream about working on people's backs. I wake up going, oh shoot, I just worked all night.
I've had chronic pain since I was a teenager and suffered from osteoarthritis.
Okay.
And it kind of increased over the years to the point where now I need a knee replacement and I'm not even 49 years old.
Okay.
I have severe neck pain that goes down to my left
Shoulder blade?
scapular.
Yeah, in between the shoulder blades?
In between the shoulder
Okay.
blades, especially on the left side, I have severe lower back pain.
Okay.
And mid back too.
Mm-hmm.
You know, it feels like I wanted to be cracked all the time.
Okay.
Brain fog.
Okay. Have anybody taken any imaging of your spine? Has there been any imaging?
Yes, I
When,
have.
when was the last imaging that was taken?
It's not even a month ago, and I even brought it if
Okay.
you want to see it.
I would love to, yeah.
So I had knee surgeries, 4 and 4. You know, throughout the years, they go in, they clean it up,
Sure.
they do everything. But now it's to the point where I just saw the surgeon yesterday.
Yes.
And he told me that's nothing else we can do. There's no more arthroscopies. We need to.
You want to do a total knee replacement?
Yes, but I declined now because I'm not ready yet.
Mm-hmm.
But I will get more of the gel injections
Mm-hmm.
because he worked a little bit in the past. So I asked him to first try the injections and then we can
Okay.
think about it.
I'm just going to look at this real quick here.
Sure.
So,
Started in 99.
right, the bones, see, the joint grows when you overstress a joint. And when it comes to the knee, very, very commonly we find that the inside, the medial meniscus, gets worn out faster than the lateral. The meniscus is the same age. The medial and lateral were all created at the same time. So why are we seeing that the inside wears at a faster rate than the outside?
Yeah.
It has to do with alignment, right? Because if we're
Yes.
stressing this part out more, the cartilage wears out faster, the bones grow. So when you overwork a muscle, mine didn't do too good, but some guys, right, they work out their
Yeah.
muscles and they grow really big, right? When you stress out your skin becomes callous. When you overstress a joint, the joint grows, and that's what they're operating on. They're going in there and they're shaving off the bones and they're trying to clean up stuff. But the very act of doing that surgery is stressful to the joint, which then makes the joint
Yes.
want to grow larger, and then it comes back repetitively. That's why you're saying you
Yeah.
had 8 knee surgeries. It's almost like, how far do we go with this?
Correct.
So and when they do those arthroscopic surgeries, they don't not only just shave off the bone, they sort of clean off the disc or the meniscus in the knee, which is similar to the disc in your back. It doesn't regrow. It doesn't have any feeling, the meniscus. And so as that meniscus keeps getting shaved or worn out, the bones get closer together, and that's what creates all that pain in there.
Yeah.
Is it just, where is the most pain in your knee?
Right
Right
where
where-
you had your hand.
Yeah, that's where typically all surgery
That's the
happens.
most pain.
And let me just stand up real quick. Let me have you
Oh,
just stand up. Sort of march in place for a second. Yep, and then just relax look straight, stop walking, and then just look straight forward for me. Just find neutral. Okay. Just looking at you. So your feet look pretty good. Actually, your toes aren't. Sometimes what I'll see is that the feet will
Like
toe
this?
out, and that puts more stress. So I'm not seeing much toeing out of you, which is good. I'm curious.
I tend to go inwards
If you
more.
did you used to have when you were younger? Did you used to see more or no?
I don't remember, but only my mother would know. But I don't remember
Okay.
walking like this. No.
We'll examine it in a second. I'm just curious. Relax, sit back down. The same thing happens in your lower neck. When the joints in your lower neck are overstressed based on your posture and mobility, the joints will grow. The pain on the shoulder blade is from a joint referral pain. So the knuckles in your lower neck, the arthritis in your lower neck,
Yeah.
will give you pain to the border of the scapula.
Yeah.
There's really not, and it will cause some of the muscles to spasm in there, but it's really ultimately from the neck. And
yeah.
ultimately, if your upper neck was working properly, it shouldn't be possible to have arthritis in your lower neck without first having arthritis in your upper neck. This is because biomechanically your upper neck is supposed to function before your lower neck. So how did we, I'm gonna look at your x-ray report in a second, but I suspect before I look at it that there's a lot of arthritis in your lower neck and no arthritis in your upper neck. Does that make sense?
Yeah.
So there's a uneven wearing out, right? So one section is older than you are and another section is younger. And the goal of our care needs to be on that young area, restoring its functionality and not trying to treat the symptom. The older area, it's already doing too much. That's why it's injured.
I had an x-ray previously at the chiropractic
Yes.
office, and he said that my neck is bowing the opposite way.
Right. So that's what we call antalgia. Your neck is, the joints get inflamed, and then your neck reverses its curve
Yeah.
to take stress off the joint. That creates the hump and the dowager and the slouching forward you see people getting to as they age. It's an avoidance. The disc on the front has no feeling. The joints on the back have a lot of feeling. So we're going to have this desire to round forward. Because you've been overstressing your lower neck for so many years, and that stress hasn't been stopped, nor has it been redirected,
Yeah.
your lower neck is trying to find a comfortable position. Here's the x-ray reports we're dealing with. So, they call it degeneration when a bone grows. That doesn't make any sense to me. It's regenerating. You don't, if I cut my skin or go like this a lot, my skin regenerates and gets larger and thicker.
Yeah.
The joints in the same way grow when you overstress a joint. Medically, they call it degenerative joint disease. I call it regenerative joint adaptation. The joints are regrowing because they're adapting to handling more stress than what they're supposed to be handling. Again, like I said earlier, so there's 7 cervical segments, 7 vertebrae in your neck. The 5th and 6th, which are the ones at the bottom, are the ones where there's overstressing happening. The upper neck they're not talking about the upper neck at all on here. Does that make sense?
I don't know, maybe
no,
yeah.
because there's normal. They only on a report they only mention what's there. You understand?
Oh, I
If it
see.
looks normal, they don't mention it, which is because your upper neck still looks the same as it did when you were 18. You understand?
Okay.
Part of your, like if you only chewed on the right side of your mouth and you only chewed food on this side, those teeth will get worn out faster than the teeth that you don't chew on.
Yeah.
So you have brand new teeth on one side and all these worn out teeth, and they're trying to treat the worn out teeth, and we have to take the stress off that and start chewing on another area. All right, so and then on your lumbar report, they're talking about, so the 4th vertebrae actually is moved forward on the 5th one. So there's, essentially you have what would be termed almost like a mild broken back. The vertebrae are supposed to always line up. There shouldn't be any forward back motion of the vertebrae. There's a grade 1, what they call spondylolisthesis. The vertebrae is sliding forward. That would have been a fall on your bottom. A pretty good, but
People keep telling me that. Did you? Because I used to play a lot of soccer and volleyball back in Brazil.
something happened.
And I probably fell or something,
Yeah.
but I was so tough back then.
I've seen it happen from falling out of a hammock. Just a guy in a hammock, because I had an x-ray of him before he started care, and then was in a hammock, and then one of the strings broke. And he just went maybe 3 feet
And
onto his butt. Took an x-ray of him, spondylolisthesis. So it doesn't have to be it can just be a sudden jolt that tears the
Yeah.
ligament, and that allows the vertebrae to slide in a direction. So the hole that the nerve goes through, half the hole is made of one vertebrae and half the hole is made of the other vertebrae. So as one vertebrae slides forward, do you see how the nerve has to come through this little hole now?
Yeah.
Right? Instead of having this giant size to deal with, you start having a lot smaller hole that the nerve is having to pass through. So
Okay.
that's why you're having severe lower back, is
Lower back.
because now a lot of that can be reduced by working and restoring that curve in your lower back, and we'll talk about that in a little bit.
Okay.
But the arch in your lower back, so they found that when they took people and they bent them forward, that spondylo actually gets worse. When you're upright, it's less, and then when you arch back, it actually goes away. So we need to get that curve, the lordosis, back to your lower back. In order to do that, we have to first soften up your spine. We can't try to make your spine that's rigid
It's too
and
stiff.
get it back into a curved position. So it's like clay or like metal. You have to heat it up a little bit, make it soft, and then we can reshape it back into that curved position. The curve is a natural curve that we develop when we're 6 months old, when we're crawling. And this curve was supposed to take us through life, injuries, school, sitting. We round forward, put weight on the non-sensitive discs off the joints. That makes us lose this curve, and like a ladder, all the weight, L4 and L5 are the last two vertebrae in your lower back. So those two are older than you are. The good news is, again, there's no mention of any other vertebrae. All they're talking about is L4 and L5. So there's no mention of L1, 2, and 3. Usually they'll say the word unremarkable.
Yes.
And unremarkable means nothing to see here. Normal, they'll call it. And I go, it's not normal to have a vertebrae that's younger than you are. I expect your whole spine to be your age, right? If your skin still looked the same as it did when you were 18, you would go, that's amazing,
What happened?
right? So part of your body inside is young. And what I'm seeing from your reports is everybody's focusing on the older parts and trying to treat the symptoms that those older parts are, instead of just saying, let's just put them in retirement, give them a vacation, and restore the alignment that we're supposed to be in so that all the parts of your spine are working even. Have you bend both the knees for me? All right. Take one deep breath in for me. I'm going to help you sit up, and then take a deep breath in, and then lay back for me. Exhale for me all the way out. There you go. All right, deep breath in. You did great. You did great. Exhale. Let it all go. Take a deep breath in. Let all the air out. Let your chin go down a little bit. Let it go. A little tight up there. Yeah, we got work to do. It's okay. Let me have you on your side face. So there's a lot of arthritis down here, and no chiropractor should really adjust that. If they're adjusting your lower back, I'm sorry. It's not good, because this area has been overstressed, like a sprained ankle. If you twist your ankle and sprain it, you shouldn't go in there and manipulate it more. It needs to be left alone, braced. And the goal of this adjustment is to adjust the SI joint. The SI joint is, along with the middle back, is responsible for taking stress off your lower back. If these joints are working, not all the stress is going to happen in your lower back. So we're going to be adjusting the SI joint. It's unfortunate that many chiropractors are manipulating this when we can see an injury in there. And there isn't any injury visible on the surrounding joints. We need to work on those areas. All right. Very good. Take a deep breath in for me. I'm happy to rotate a little bit. Exhale. It's okay. Nobody falls. Good. There you go. Good. All right. Deep breath in. One more time. Exhale. It's okay. Other side for me. It's okay. Exhale. It's okay. Deep breath in. Exhale. It's okay. Yeah. We got work to do. Face up. It's okay. I know. If that joint moved beautifully, I'd be confused. I'd be confused why your lower back is injured if the surrounding joints moved the way they're supposed to, right? It wouldn't be possible for one area to be injured and all the other areas to not be injured unless that were so. So we're just going to go through here. Wow, your upper neck is all displaced to the right or subluxated to the right. We got to realign this. Real gentle here. Turn your head left for me. There we go. It's okay. There you go. Let it go here. It's okay. Yeah, it's okay. I got your head. It's okay. Yep. I'm going to loosen it up in a second. I wanted to see how loose this joint was before we massaged it. It's okay. There we go. Okay. All right. We got work to do.
It was a good one.
It's okay. We're going to get that upper neck moving for you. Our left atlas moved a little bit because it's more, how about this? It's less misaligned. The left side of your neck is less misaligned than the right. That's why I got the left side to move. Does that make sense? Before I massaged. The right side is more misaligned. That's why I started with it first. I'm trying to go for the biggest misalignment, which is her right side of her upper neck. This is why it's going down your left arm, right? The numbness is going down your left arm because of your right upper neck avoidance. It's causing a left abuse, but the left side is actually closer to its home position. The right side is very displaced over here. So we have a right misalignment, right subluxation, left lower neck compensatory abuse. The left side is not the problem. The left side is just the area that's done double the work because the right side doesn't show up anymore. The difficulty is that I have no bottle of Dr. Ed to give you that I can send you home with that can go in here and continue the care of loosening this joint. It is severely stiff, very
Yeah.
stiff up here. And
It's a process, right?
right, if they're going down here and adjusting your lower neck, that's very unfortunate. Your lower neck is injured. We can see that by the X-ray. There's
And they pull with a
strap.
thing, yeah, they pull my neck up, and it hurts.
It's difficult, right? Sorry.
No, yeah.
Go ahead. Yeah, is it the yanking one where they take it and they yank real hard?
Yeah.
Okay, I'm so sorry. So I know, yeah, it's just, you got it all glued up here. You're way too young to have that much tightness on the atlas axis. So we gave names to these two vertebrae up here because of how important they are. The atlas and axis, about 60% of the work of your neck is supposed to happen in your upper neck, and not just 60%, but the first 60%. So you shouldn't be able to overstress your lower neck if the upper neck is working properly.
How did that feel? Pretty.
Sore.
You actually feel, yeah, it hurts, but it's like, it's a good pain. It's hard to explain. Like, it hurts, but it's,
Like almost a relief. at the
yes,
same
I
time.
feel relief.
Yeah, we're gonna shut down the lower neck. Come on. Oh. I got pretty strong thumbs, but you got a pretty strong upper neck. Wow. Hidden power up here. Oh. There we go. There we go. We're trying to see how your neck likes to be. We're trying to retrain you to be back here. Your neck belongs. Does that make sense?
Yeah.
And your neck is so used to looking down. We have to sort of retrain your neck to want to be back in the curved position. Yeah, there's just very quickly there's a mark coming out up here. This is from the congestion in your upper neck. The circulation is pumped by mobility. We call it imbibition, and so sometimes when areas get very tight, the blood vessels have a hard time pushing blood into those tight areas, and so not only releasing the tension in the area, but then me massaging it helps to push blood into these. It's like the top of a hill or top of a mountain. It's hard to push water up that high, and so because of that, the circulation has been less than it's supposed to be up here, which creates an environment where all this acidity can be trapped up here. All of this has to be worked on until no more marks come out of your neck. And it's just, there you go, doing great. I mean, how would you, not normal. Yeah, common, but not normal. Yeah, just, whew. It's tough. Right there.
But I'm happy that I still can get hope to get a little
Absolutely.
better.
You know, there's, like I said, all these younger parts of your spine that just you need to learn how to bend in those areas. You don't get to decide when you're looking at your phone which part of your neck bends. It's on a voluntary, structure.
Yeah.
So if an area that isn't volunteering, you don't even know it exists. It's at home sleeping. It doesn't come into work. You only have your lower back and lower neck coming into work, and that's why you have severe areas are done. They need to be left alone, iced, braced, do you understand? And we can't ask them to do more. Parts of your spine are older than you are. We can't expect them to keep doing more before they run out of life. Open up a little bit. There we go. Okay. That's just real tight up here. Wow. Right there. So these are the anchor points. These are the attachments up on your occiput here. These muscles are tighter because of your forward head posture. The more forward the head goes, the more these attachments pull on the bone. You can't ever relieve this tension up here without getting the head back. And along with getting the head back, restoring the cervical curve. Yeah, wow, it's just all of that needs to be pressed back down. move there, move a little bit, yeah. It's okay. Come on. There you go.
Yay.
Wow, did you hear that sound? It
Yeah.
was like muffled. It was in fluid. You know what I'm saying? That's what I try to tell people. It's like stuck in mud or fluid. It almost sounds like you hear a sound underwater. It's like, it's not as crisp as a sound that's in air. The water is muffling it. Your atlas is there. It's just all this fluid and inflammation up there that made that.
Yeah.
I wonder how the microphone picked that up, but here we go. Come on, yeah. There it is, yes. I know, yeah. Yeah.
Yay.
You did great. No, that's just restoring. It takes a handful of visits to make, so we got it moving, and then there's going to be a level of, I didn't like that. You know, your joints get a little upset.
Yeah.
Because they haven't, that joint, it's like if I hadn't bent my finger in 10 years. Your body's going to initially react to that movement and say, lock it down.
Yeah.
And you have to be consistent with having, care to some degree on that upper neck, keep it moving, and then once it's soft, we can start, and I'll show you at the end of the visit how we mold the curve back into your neck. Wow, everything's frozen down here. Gotcha. I don't need the click, I need the movement. I need the joint to not feel like it's frozen to the joint that it's connected to, the bone that it's connected to. All these bones are connected by joints, and the joints are just frozen. All right, I'm just feeling just frozen. There it is. There we go. Okay. You stand on that foot too much.
Yeah, to compensate for the knee for that knee.
Gotcha. Yeah, so what happens is all these joints are jammed on this side. These all moved with very little resistance. Your left side, along with that left abuse, left arm, we have. If these muscles are tight, these muscles all attach on the tibia. The tighter these muscles are, the more this pulls and compresses the meniscus. So you're not allowed to have any soreness up here. Tightness and soreness in the quad, vastus medialis, gracilis, the muscles on the inside of the knee. If there's tightness in here, it doesn't allow the meniscus to breathe. The meniscus is like a sponge, it needs water. But if it's under constant compression because there's muscular tightness, it grinds. It's like having your teeth clenched and then talking. You're just constantly grinding the teeth forward and back. And that ages the meniscus at a faster rate. It stresses out the joint. The joint starts to grow. They call that growth of the joint disease. The joint growing is not a disease, no more so than a muscle growing is a disease. It's not a disease process. It's adapting to the stress, like right there. That's all has to be. So they are already scheduling you for knee surgery, or no? They've already.
No, I asked them to get the gel first.
Yes.
So I can buy some time.
Okay.
I don't know.
I'm gonna show you some.
Yeah.
I'm gonna show you some knee stretches. See if we can open it up a little bit, but they do tie my hands to some degree. When you operate on a knee, it's kind of like a domino effect. It creates difficulty in stopping the next one.
Yeah.
So it's tough. I'm not gonna sugarcoat it. It is tough to stop future. I think we can delay it by trying to rehabilitate whatever meniscus you have left in here, but the bones are going to want to grow back larger. Every time you go in there and shave them off, the body says, we didn't put enough calcium last time. Let's put more calcium. It's
According to them, I have nothing. Is it possible?
because they took it out. I've never seen anybody have no cushion that didn't have knee surgery. Every time they do knee surgery, I told you, they go in there and they clean out the bone, but they also take off some pieces of the disc. So now they've removed all the disc, meniscus, same thing. They've removed the meniscus. Where did it go? You guys took it out.
Oh my.
And now this is where they do the same thing with the discs in the spine. They do what we call discectomy, microdiscectomy surgery, where they remove the disc and they remove the disc and they shave things off, and then there's no disc left, and then they want to do stem cell therapy to try to regrow the disc. It's like, make up your mind. Do you want the thing in there, or do you not want it in there? You need the cartilage. The cartilage is very similar to tread on your tire. There's only so much so many revolutions that the tire can make before you run out of tread. What I'm saying to you is that I find frequently that this ages faster than this. There's some level of mobility problem. This is too tight in here. Does that make sense? If just simply this was too tight, then this part of the knee ages faster. If you have piriformis contraction, that'll make your toes foot flare. That puts more stress on the medial meniscus. That's why when you were standing, I was looking at your alignment. So we want to release any tension there on vastus
It's
medialis.
like there's a ball in there, it's like a.
Spasm. Yeah, no, there's no,
Hurts.
right there. There's
Hurts a lot.
a spasm. That's the cause, right here. This was the cause for why the knee was in a vice grip. And then you had your knee in a vice grip for 20 years and now you've destroyed the meniscus. But nobody checked, and we should do quad stretches to, you can stretch this by yourself. Sorry, I know.
You need a break, tell them.
And then this attachment here needs to be pressed back down. That's gotta be. All right. This would be the way you do it at home. I don't know, it's hard to do it yourself, but you cannot have any tension, soreness in your quad. You're going to have knee problems if the quad stays tight, sore, lactic acid, contracted. So we unglue the muscle here. That opens up the grip on the meniscus. That allows the meniscus to get a meal. Nutrients, blood. Blood is what brings nutrients in, takes the waste out. It's how your body's designed to heal and keep tissue healthy. The meniscus is just a piece of tissue that it's a cartilage like your ear that as it ages, it dehydrates, becomes thinner. We call it desiccated is the medical word for the cartilage in our body. When it ages at a faster rate, it becomes dried out and thinned. Okay. Lovely, that feels great. Right there. You being in pain prevents you from further damaging yourself. The cortisone shot, they say, is anti-inflammatory, and it's partially true. It does make the tissue weep. It doesn't allow it to hold fluid, but primarily it's a painkiller. You understand? It prevents you from feeling the knee as much, which then, if you can't feel it, you're going to do things that you wouldn't ordinarily have done. That makes the bones grow, causes more stress. I don't see how we can get to a more positive place with this care. I'm not saying we can't give you some relief, but we're not fixing the source of the problem. And if anything, we're allowing you to further damage the area. Like if I put my hand on a hot stove, my hand would get red and inflamed and swollen, and I shouldn't inject it with cortisone. I should just remove it from the stove. You distract and cover up the problem, then your body's own natural way of avoiding the area isn't going to happen, which is going to further accelerate that aging.
It does make sense.
But we demonize inflammation. We act like inflammation's your enemy. It's this evil thing inside of you that's just trying to hurt you. And no, inflammation's a tool that your body uses to replace itself. It's no different than road repair crews. Is it annoying when you're driving on I-4 and all 3 lanes go down to 1 lane? Very annoying, I hate it. But we all know that roads need to be repaired. And I don't want to drive on pothole roads. We don't go out there and we need to get rid of these road repair crews and get them off the street, right?
Yeah.
They're not the problem. They're trying to fix the road.
Gotta go through it.
They're trying to repair the road. Now, hopefully they do it in the middle of the night. But my point is, and that's what your body tries to do. It tries to heal itself in the middle of the night, but if it doesn't finish repairing the road in the middle of the night, it's got to keep trying to do it the next day, and it's not finished. All right. Last 14 years, all I've done is look at people's backs. I wake up in the morning, I look at people's backs, I come home. I go back to work, I look at people's backs.
He jokes, he's like, I go to sleep and then I dream about working.
I go to sleep and I dream about working on people's backs. I wake up going, oh shoot, I just worked all night. I know, it's okay. We see patterns, and if they're, in the car manufacturing world, if we saw patterns, there'd be a thing called a recall, right? They would recall all the vehicles for a common problem, mainly if there was a safety issue. But anyway, in the spine, we see common problems, and accelerated aging of the lower neck and lower back are common problems, and we hide that information from the public. We don't let the cat out of the bag. We don't pull back the curtain from Wizard of Oz. We don't let everybody know that we're seeing this common pattern. And JMPT published, I remember when I was in school, the surgical rates. 75% of surgery is L5, 24% is L4, 1% at L3. Do you understand?
Wow.
And almost 1 in a million, very, very rare up here until the lower neck. About 33, C5, 6, and 7. And so why are 5 of the 24 vertebrae encompassing 99% of surgery? Can this be prevented? Should we be doing something at a young age? Can we be checking things, right? Is there a way to help prevent people from having heart disease or diabetes? We ask a more preventative question, and our world doesn't do prevention with the spine. We just do reaction. We treat problems, we change engines, we don't do oil changes. Well, Dr. Ed, you and your oil changes, a bunch of nonsense oil changes. Just let the engine smoke and then replace the engine. Right? That's the world I'm living with, and I'm the crazy one for suggesting that if we maintenance it and work on it, we can extend the life of your spine.
Yeah.
You have plenty of parts of your back that can take you to 100, but you don't bend in them. These areas are reluctant up here. Way too much rigidity. And the areas that are hurting are saying, we've had enough. Okay. Work on those shoulders in a second, but yeah, this is real frozen here. If I'm going too hard, let me know, okay?
Okay.
All right, I'm going to try to go, my goal is to go as deep as I think you can handle. Okay. That feels lovely. Right there. 12 vertebrae in the thoracic cage, 4 joints at every level. So there's 2 facet joints and 2 rib head joints on each side. So 48 joints in your chest. A lot of mouths to feed. A lot of potential areas that can get upset. And our body's answer to these joints getting upset is to hunch, is to hump forward. Does that make sense?
Yeah.
And when you do that, all the stress mechanically gets sent down to the small of your lower back. We have to get your alignment fixed, but in order to get your alignment fixed, we first have to restore your mobility. You've lost the mechanical movement that you used to have in here. And then one of the common problems that women face is dealing with the brassiere. The bra binds up your middle back and further feeds this rigidity of the middle back.
Oh.
Okay. Yes, right there, yep. That feels lovely, Ed. I'm sorry.
It's like,
I can feel it. I know it's horrible. Almost done. So your upper back, remember when I did that hug adjustment? This area didn't want to move.
yeah.
That's also responsible for why your lower neck is overstressed, is the areas right directly adjacent to the vertebrae that are injured. They're the most responsible. Yeah, there's a rib injury here. You've had a collision, maybe soccer. There's a
Yeah.
very obvious injury. Right there. The body, whatever happened, your body expected it to happen again. So it puts guarding up, fortification up to protect the area from a future injury. And while that may be good for that area, it again leads to problems elsewhere. This area can't be allowed to quit. I need this area functioning, even though it might look at me and say, she hurt me a long time ago.
It was almost 30 years ago.
Right. I think you'll be there. And there's something right here. You've had this area is kept healthy by the nerves that leave your lower neck. So having that referral pain from the joints in your lower neck to this area does cause an internal disruption in this tissue. It causes it to not function internally properly. So I don't know if this would be an injury here or just a connection between your lower neck and this area. Because the lower neck's upset, this area becomes upset. While this is a rib injury. There's not nearly as much rib injury. There's some, but there's not nearly as much rib injury on this side. So going back to what we talked about earlier, that side posture adjustment, I didn't give you a pass rating for either side, and I'm sure it wasn't very fun. My point is that this joint not working right here needs to be restored. We need mechanical function of the sacroiliac joint. Right there. Was your labor natural?
Yes.
Okay. Sometimes after you give birth, this joint, through the process of giving birth, is heavily injured because of the stretching of this joint to get the baby to be born. And so sometimes this joint gets really stiff postpartum, right? So after you give birth, this joint says, she's going to injure me again by giving birth to another child, so I'm going to lock myself down. So your child is in their 20s, and so 20 years ago, this joint was upset and decided to quit, and that creates an environment whereby your lower back can now. So I recommend any woman that has, a child naturally where this joint is stretched, that we need to make sure it doesn't quit after you give birth. Even though it might feel better, right? As this joint stiffens, again, my backside joint's not a problem until you touch it, until you dig your elbow in there, and now it hurts, but we can't allow this to just lock up after giving birth. If everything I did was easy, I'd be confused that there would be any arthritis or there'd be any pinched nerves or stenosis, disc injury.
First time is the most difficult,
Right,
then
right.
it gets better.
Yes. Doing great. There you go. All right, here we go. That's the top of the joint right there. Right there. Lovely, Ed, right there. Yep, here we go. Here we go, a little bit. There it is. Good. Mhm. Okay. That feels lovely. I know. So,
Oh, wow.
right, so we have, that's that rib injury you have on this right side, that left upper side, with that shoulder blade pain that you're getting. But it's all ultimately, your neck likes to bend in your lower neck too much. So we want to get this area bending more. The lower back's overworked because this area has just been bound up and stiffened up,
Okay.
and we have to restore that. And we're going to show you in a minute some stretching we can do at home to start the process of loosening your middle back. It's more difficult, or something I want people closer by to, it's difficult to loosen your upper neck by yourself, but we can start when you're between now and the next time I see you, working on the chest and loosening up that middle back area.
Okay.
Go ahead and tilt your head to the right a little bit for me. Tilt your head right. There you go, good. Mhm.
Oh,
Tilt your head to the right a little bit for me. There we go.
that's so cool.
All right, go ahead and tilt left a little bit. There you go, good. Nice and loosen that back glued up. Some people come in here and their ears are completely frozen. Tilt your head left a little bit for me.
Oh, it doesn't hurt.
You do really good. Yep, breathe, exhale. Good. Good. Should open that up, and then you, for the most part, you're keeping these in the middle, and then now you'd move down 1 inch. You'd roll upwards a little bit, just 1 inch. Good. And then do the same thing. Stretch your knees side to side. You're trying to work these drawers in, the vertebrae into the,
Yeah.
and then in working this curve back in your spine, that anterior listhesis, that spondylolisthesis in your lower back, can be reduced as we restore the cervical or the lumbar lordosis in your lower back. And
Now go up.
then move 1 more inch, you got it, yep. Yep. And then the roller allows you to move around. There's a better stretching device called a Deneroll that we graduate to when this becomes easier. And like right now I have this much material behind your head. The idea would be to remove,
Really?
I know. Are you
Oh boy. All right.
get the idea? And I still have 1 more book. I still have 1 more. I have 1 more of these behind your head.
Wow.
I know, this is too overwhelming. We need to back off, put this back behind your head. Do you understand? If it's too much and you can't handle it
For 20
for
minutes?
20 minutes, right? Do you understand? I don't mind making the stretch easier so that you can do it for longer.
I can try maybe start 5 minutes all the way down and
No, it's better to do 20 minutes at a milder level than 5 minutes at a deep level.
Okay.
So you only do the level of depth that you can do 20 minutes. That's what you start at. And then as you're getting to 20 minutes, you'll be able to go deeper and deeper with the stretch to the point where your head will be on the floor. It's no longer difficult.
Thank you so much, doctor.
All right,
You're the best.
All right, thanks so much.